Hi there. My name is Kerry and I'm a licensed clinical social worker with postgraduate training in marriage and family therapy. I've been in private practice since 2003, and while I provide individual, couples, and family therapy, the primary focus of my practice is on working with adolescents. In working with adolescents, that can mean addressing a number of issues or treatment concerns. So that can be anything from self harm, self esteem, academic performance, family conflict, some of the early emerging eating disorders or substance use disorders. I really strive in my private practice to stay relatable to the teens that I work with, making sure that I'm showing them with non judgment that I understand where they're coming from so that in me they find a safe place to work collaboratively through the issues that are impinging on their day to day life. I also want to demonstrate to the parents of these teenagers that I am going to guide and assist their teens in making healthy and appropriate decisions and not just letting them run amok or get stuck in repetitive patterns of behavior. As a social worker and trained in that systemic modality, I really want to work collaboratively with other providers, be that within the school system. So, the school social workers, the school counselors, teachers, whether there's pediatricians or psychiatric providers, I want to collaborate with them as well. And then I truly involve the family in the work that I do. I don't believe in treating an adolescent in a vacuum or treating anybody in a vacuum where they exist in their day to day functioning as part of a system. I want to address that functioning within the system. So, in inviting the parents back into the work that I'm doing with my teenagers, I want to allow and empower my adolescents to truly be the one telling me how we're going to involve their family. Does that mean I'm just sending email updates? Does that mean I'm inviting them into the session? Are we doing family therapy sessions collaboratively all together? Or at times, I might just be doing a parent informational session and not having the adolescent in the room. I, again, trust them to know what's going to work the most effectively for their family and what's going to help them feel the most comfortable, trusting me to be their voice and to be that advocate for them in the session. When we're doing that family level of work, then ideally we are working on some level setting and of expectations on both sides, as well as trust building again, so that we can have conversations about stuck points in the family system or breakdowns in communication without it becoming immediately conflictual, but truly working towards a healthier, more open communication style and just a more enjoyable family system. I really believe that as so many of our patterns of behavior, as well as emerging issues that we experience as adults, truly onset in that adolescent time frame, my work with teenagers arms me very proficiently to work with adults, to work with families, to work with couples, where we're looking at how those early onset patterns of behaviors are manifesting in the adult world now and addressing those too from our adult brains.